Nagubuka na yaw.
Normal na lang niya sa ako. Tutay na rin.
Ay sis, ba super to sis na na.
Hindi ah.
Anong hindi? Ay grabe na na. Iyay mo
A
ubos
day in
sis.
a life as a pertussis patient. A day in a life as a pertussis patient.
Whooping cough is also known as pertussis. It's a very contagious respiratory illness caused by a type of bacteria called Bordetella pertussis. This disease is only found in humans. Whooping cough bacteria attach to the cilia that line part of our upper respiratory system. It is also an acute infection. Outbreaks of pertussis were first described in the 16th century by Guillaume de Bailly. There are three classifications of whooping cough: catheral, paroxysmal, and convalescent. These are the signs and symptoms of whooping cough.
Okay ka lang, pre? Ay, kakapoy. Kaya siyang dispasyo.
Ganit man ang activities, magalaga sa ako.
Gani, man, tapos nagkuksam na nato.
Ano man pa, no? Talikatoon pa.
Ay, nakakaon ka na?
Wala pa. Wala po ako papanaw. Ikaw yan.
Wala man eh. Siyempre, nagutom man ko subong.
Nakatapangitan sang kalanaan.
Ha?
Ganit man. Sakit na dughan pa.
Okay ka lang, pre. Basi sa init niyo.
Hindi na. Nakapoy na.
May nakita ka na nga restaurant di nga lapit?
Ato oh, kita mo to?
Ay, tsak to. Han ba? Gutom na gid kuya mo.
Nata. Ay na ta.
Ano order ni mo?
Lumulan ako ganay, ikaw na lang ganay.
Kagi na ka pa bala na notice na nagaupo ka na. Tapos tukapoy ka. Tapos kasakit dughan mo. Tapos wala ka nagana magkaon. Okay ka lang?
Okay na pagawa.
Kadto ka init kasi mo ha?
Buta kayo doon kainit, mandaan subong.
Basi may ikilanan ka sis?
Wala po kabula ka pa konsto sa doktor.
Bagal mo Aaron, may kilala ko di ba lang nga doktor? Gusto mo? Ano, itawagan ko siya?
Sige, pwede man.
Hello, Doc Zam? May kilala ko di ba lang nga may pertussis symptoms? Congrats! May pertussis ka!
Yes! Manifested!
Pertussis can occur at any age. There is an increasing amount of adults and adolescents who are being diagnosed with pertussis. At present, the age groups with the most pertussis diagnosis are infants below 1 year of age and adolescents between 10 and 20 years of age. Pertussis is highly contagious. Secondary attack rates exceed 80% in susceptible household contacts. The incubation period is usually 5 to 10 days, but symptoms may develop up to 3 weeks before exposure. Populations at increased risk for serious complications and death from severe pertussis include infants aged under 12 months, women in their third trimester of pregnancy, persons with pre-existing health conditions that may be exacerbated by pertussis infections, such as immunocompromised persons and persons with moderate to severe asthma. Symptomatic persons who receive effective antimicrobial therapy for pertussis are no longer contagious after 5 days of appropriate treatment. In studies, 12 to 32% of adults with prolonged cough have been found to have pertussis. It is estimated worldwide to be 48.5 million cases, with a mortality rate of nearly 295,000 deaths per year. The case fatality rate among infants in low-income countries may as be high as 4%. Attack rates among susceptibles are very high, ranging from 50% to 100% depending on the nature of the exposure. Attack rates have ranged from 25% to 50% among unimmunized school contacts and 70% to 100% in households. Natural disease provides almost complete protection during childhood, whereas vaccine induced immunity is less complete, with an incidence rate of 10% to 20% in full immunized children and up to 50% in household settings. Whooping cough treatment includes taking antibiotics exactly as prescribed by the doctor. Keep your house free from irritants as much as possible that can trigger coughing, such as smoke, dust, and chemical fumes. Using a clean, cool mist humidifier to help loosen mucus and soothe the cough. Wash hands often with soap and water for at least 20 seconds. Eat small meals every few Eat small years every few hours to prevent vomiting. Get plenty of fluids, including water, juices, soups, and fruits to prevent dehydration. And lastly, do not take cough medicine unless your doctor recommends them. Giving cough medicine will probably not help, and it's often not recommended for children younger than 5 years old.
There are five classifications of tuberculosis. First is TB0, which has no TB exposure and not infected. Next is Class 1 or TB1, which has no TB exposure and no evidence of infection. Next is Class 2, which has TB infection but no disease. Next is Class 3, which is TB and clinically active. Class 4, which is TB but not clinically active. And Class 5, TB suspect. Tuberculosis is spread through the air when people have active TB disease of the lungs or throat, cough, sneeze, speak, or sing. Tuberculosis is a potentially serious infection disease that mainly affects the lungs. Others nearby may breathe in these bacteria and become infected. TB is not spread by touching, kissing, hugging, or sharing personal items.
So, for tuberculosis, you may be experiencing the following symptoms, such as bad cough, which lasts longer than 2 weeks, pain in your chest, coughing up blood or sputum or your mucus, experiencing fatigue or weakness, loss of appetite, weight loss, fever, and night sweats. Should you be experiencing any of these symptoms, we strongly encourage you to consult with your doctor. About a quarter of the global population is estimated to have been infected with TB bacteria or tuberculosis. About 5 to 10% of people infected with TB will eventually get symptoms and develop TB disease. A total of 1.3 million people died from TB in 2022 alone, including 167,000 people with HIV. Worldwide, TB is the second leading infectious killer after COVID 19, above HIV and AIDS. In 2022, an estimated 10.6 million people fell ill with tuberculosis worldwide, including 5.8 million men, 3.5 million women, and 1.3 million children. TB is present in all countries and all age groups. An estimated global total of 10.6 million people died with TB in 2022, equivalent to 133 incident cases per 100,000 population. Among all incident TB cases, 6.3% were among people living with HIV. Most TB cases in 2022 were in the World Health Organization regions of Southeast Asia, 46%, Africa, 23%, and the Western Pacific, 18%, with smaller shares in the Eastern Mediterranean, which is 8.1%, in the Americas, 3.1%, and Europe, 2.2%. People with latent TB infection don't feel sick and aren't contagious. Only a small proportion of people who get infected with TB will get TB disease symptoms. Certain conditions can increase a person's risk for tuberculosis disease: diabetes, weakened immune system, malnourished, and tobacco use. Babies and children are also at higher risk. Common TB medications include isoniazid, rifampicin, pyrazinamide, and ethambutol.
Ay, na to sila man! Ay, di sila nakanto. Ay, actually, kasi kami
Hindi kami yun sa Frozen.
Hindi, napakapulit. Ang nagpunta magbalik. Ito wala. Nakamuya.
Ay, na-starstruck kami na biscuit sa Frozen.
ako ikaw.
Ay nga, daw ka putla si mo, no?
Karapsi si mo na gano'n kaya.
Kapoy-kapoy. Ito this past few days. Sa durdur or brahon. Tapos,
Ang do may badlo ang ako yellow kundi
Oo, ano na. Kago lagi kayo ka na magkaon.
Ate, sis, delikado na na.
gani basi malala na kundi ang magpakonsulta.
Gani, need po din yung magpakonsult sa doktor.
Gani, sige. May ara ka mo kilala?
Oo, do may kilala kami, kilala ni Ana.
Oo. Doktor gid saya.
Gusto may video call na to sa phone.
Sige, pwede gid.
Ayan. Hi, Doc Ja. May kilala ko, di galing
Hi,
ang
Doc
friend
Ja.
ko.
May kilala ko, di galing ang friend ko.
Ay, may sakit
Na
gid saya. Ari.
need niya magpa-consult kay may sakit kit saya. Ari siya ho.
So, ang nabatsagan niya pala is...
Gapang wala sa gana magkaon. Kasuka sa gana magkaon. Kon iyabad daw no color green or yellow. Kon iyabad daw no color
Oo,
green
do,
or
kamo
yellow.
na nga luya-luya sa iya.
Oo, do kamo na nga luya-luya sa iya subong.
Hello, anak kag Aaron. Bali nahambal yung kagina nga nagasuka siya sang dugo. Nadulaan siya ga na magkaon. Yellow, green or bloody ang iyang mucus. And luya pagid siya. I think may ara siya pneumonia since some symptoms and signs ng pneumonia include high fever which is up to 105 Fahrenheit or 40.55 Celsius. Coughing with yellow, green, or bloody mucus, tiredness or fatigue, rapid breathing, shortness of breath, rapid heart rate, sweating or chills, chest pain and or abdominal pain, especially with coughing or deep breathing, loss of appetite, bluish skin, lips or nails, also known as cyanosis, confusion or altered mental state.
Pneumococcal diseases, such as pneumonia, is a name for any infection caused by bacteria called Streptococcus pneumonia or pneumococcus. Pneumonia is an acute inflammatory response deep in the lungs and in the alveoli. When a tissue is infected or injured, there is an inflammatory response that is, the simplest sense, an accumulation of pus. When the deep lungs are injured or infected, pus accumulates there. Thus, pus in the alveoli is pneumonia. A common cause of bacterial pneumonia in kids is Mycoplasma pneumonia. In the late 1800s, Christian Graham used Streptococcus pneumonia to establish his cell wall staining technique, which is now known as Gram staining, and identify the bacterium as Gram-positive. During the late 1800s and early 1900s, pneumonia was the leading cause of death due to infectious disease and the third leading cause of death overall. There are two classifications of pneumonia: bronchopneumonia and lower pneumonia. Pneumonia can be spread through respiratory droplets from coughing or sneezing or direct contact with infected secretions. Pneumonia is an infection of the lungs that can be caused by bacteria, viruses, or fungi. Viral pneumonia is often spread through the air or by touching contaminated surfaces. Aspiration pneumonia, on the other hand, occurs when food, liquid, or vomit is breathed into the lungs.
Pneumonia is an infection of the lungs that can cause mild to severe illness in people of all ages, but these are highly susceptible, namely adults 65 years or older, children younger than 5 years old, people who have ongoing medical conditions, and people who smoke cigarettes. Pneumonia killed more than 808,000 children under the age of 5 in 2017, accounting for 15% of all deaths of children under 5 years. The number of deaths among those aged 70 and older increased from around 600,000 in 1990 to over 1 million in 2019. This is largely because of a growing and aging population. The death rate from pneumonia in this age group fell slightly. The estimated worldwide incidence of community acquired pneumonia varies between 1.5 to 14 cases per 1,000 person and is affected by geography, season, and population characteristics. In the US, the annual incidence is 24.8 cases per 10,000 adults, with higher rates as age increases. The treatments for pneumonia is as follows: rest and antibiotics. Furthermore, antifungal medication, antiviral medication, oxygen therapy, IV fluids, or draining fluids can also help treat pneumonia.
Acute bronchitis, also known as chest cold, is short-term bronchitis, which is the inflammation of the bronchi of the lungs. On the other hand, we also have chronic bronchitis, which can cause COPD or chronic obstructive pulmonary diseases. This is a large group of lung diseases that includes chronic bronchitis. These diseases can block airflow in the lungs and can cause breathing problems. Bacteria that can cause bronchitis include Bordetella pertussis, Mycoplasma pneumonia, and Chlamydia pneumonia. This term, bronchitis itself, was coined by Badham in 1808 to describe an inflammatory infection of the mucous membrane which lines the bronchial tubes. The classification of the disease includes acute and chronic. The mode of transfer. Bronchitis is usually spread through the respiratory droplets from coughing or sneezing or direct contact with infected secretions. Acute bronchitis involves inflammation and irritation of the bronchial tubes of the lungs. Acute bronchitis is usually spread through direct contact with respiratory droplets from an infected person's cough or sneezes. The signs and symptoms of bronchitis include shortness of breath, fever, runny nose, and tiredness.
For bronchitis, young children and older adults are at highest risk of developing this disease. Acute bronchitis incidence rate is highest among young children, especially those under 5 years old, before they have completed their vaccination schedule. During this time, viruses such as the common cold may trigger acute bronchitis. Adults over the age of 40 are at greater risk of developing chronic bronchitis due to smoking or long term exposure to lung irritants such as secondhand smoke, air pollution, or workplace chemicals. Chronic bronchitis can affect you at any age, but data shows that adults over 65 are particularly at high risk. Adults 45 to 65 are at the next highest risk. People diagnosed with chronic bronchitis under the age of 50 have been of particularly an interest to researchers. The data shows that chronic bronchitis before 50 is associated with a higher risk of developing chronic and obstructive pulmonary disease or COPD later in life and higher rates of all-cause mortality. The occurrence of chronic bronchitis in the general population has been documented to vary between 3% to 7% of healthy adults. Then, it is also estimated to be as high as 74% among those diagnosed to have COPD. The following medications for bronchitis is as follows: aspirin, ibuprofen, acetaminophen, and expectorant cough syrup.
Wala nga na, kapag gamay lang wala ni hampang ta.
Gani man, why pa to gani na 3-point shot? 3-point.
Ay, nako, sige, malain na lang tangan bangon. Ako niyan. Ay, ano naman, hindi nagasakit na to.
Siguro sa sobra ka energetic bala, tapos halita ka gina sa init, tapos nagsulod sa aircon, tapos naghampag pagita mo na gano'n.
Sige, malain na lang tang itatayban. Hi guys, sorry ka man sa Boracay.
Boracay low version, low budget version. Whee! Look, cool sand.
Wala ka lang eh. Wala nga na nga, chika naman niya. Ginaga sa katulong, sa ginagaghan mo. So, kung imo naman ilo.
Allergy
Pa-check
lang
up
guro
ka
sa
na
sand.
gaya. Pa-check up ka na gaya. May kilala ko nga doktor.
Sinobe.
Si Doc Jack.
Asthma, also called bronchial asthma, is a disease that affects your lungs. It is a chronic or ongoing condition, meaning it doesn't go away and needs ongoing medical treatment. Exposure to various irritants and substances that trigger allergies or allergens can trigger signs and symptoms of asthma. Asthma triggers are different from person to person and can include airborne allergens such as pollen, dust mites, mold spores, pet dander, or particles of cockroach waste. Its signs and symptoms include chest tightness, which is pain or pressure, coughing, especially at night, shortness of breath, and wheezing. Asthma is not contagious or spread from one person to another. Rather, asthma symptoms are triggered by exposure to certain substances or conditions in the environment. Asthma symptoms are triggered by allergens and irritants in the air.
Asthma often starts during childhood, usually before the age of 5. Many children have asthma. It is the most common chronic disease of childhood. It can cause children to miss school and end up in the hospital. However, treatments can help manage asthma. In a study, the median ages at diagnosis of allergic and non-allergic asthma were at 19 and 35 years, respectively. Similar results have been reported in asthma cohorts from other countries as well. The mean age of onset varies from 8 to 18 years among allergic asthmatics and 21 to 42 years among non-allergic patients, with somewhat lower mean ages are reported among severe asthma patients, 4.5 and 19 years respectively. According to the Centers of Disease Control and Prevention, asthma attacks in children have been declined from 2001 to 2020. Even though asthma is controllable, it is estimated that 50% of children with asthma have uncontrolled asthma. In 2021, 39.6% of adults ages 18 and older with asthma reported having one or more asthma attacks in the past year. According to the CDC, asthma attacks in adults have declined from 2001 to 2020. Medical treatment for asthma includes bronchodilators, anti-inflammatory medicines, and biologic therapies for asthma.